Hello, my name is Michael Enriquez, and today I'm going to be doing a presentation on dental caries, the microbial cause of tooth decay. So, for the introduction, dental caries is caused by a microbial activity. And then a quick definition, dental caries is a common chronic infectious resulting from tooth adherent cariogenic bacteria, primarily Streptococcus mutans, which metabolize sugars to produce acid, demineralizing the tooth structure over time. I have a quick image that is showing a cross section of a tooth that is displaying the different layers of the tooth, the enamel, dentin, the pulp. You have the gum line, you have the root canal, is showing the bone, and then the blood vessels and the nerves. Next would be etiology. So the primary microbe, like I discussed, is the Streptococcus mutans and other bacteria like Lactobacillus. The mechanism is these microbes metabolize sugars into acids that erode the tooth enamel. And then risk factors would be having a high sugar diet, poor oral hygiene, and many of the times genetics. So for the pathology, early enamel demineralization is where it starts, and then it goes on to advanced decay, penetrating the dentin, and then the formation of these cavities and pulp of the tooth or just around the gum line. As seen in this image down below, it starts off with a stage of a healthy tooth, and then it moves into a decaying uh, structure of a tooth, shown by the progression of the black space on the corner of the tooth. And then signs and symptoms. So for the obvious signs, you have visible pits or holes inside on the surface of the tooth. You have discoloration, so maybe some white spots, some brown spots, or sometimes black spots, and X-ray evidence of decay. So when you go to a dental visit, they take X-rays of your teeth, and that is to see any signs of any cavities in the mouth. And some symptoms, you'll have sensitivity to hot and cold and sweet stimuli. You have pain during chewing or just pain spontaneously throughout the day. And you have halitosis, which is bad breath. And in this image, you see that the sugars will lead to the bacteria causing an acidic environment, and this will cause damage to the oral microbiome and then lead to decaying of the teeth. And for the diagnosis and detection, like I said, you go to these yearly or um, every 6 month checkups. And aside from doing a cleaning, they're taking these X-rays. And in these X-rays, the dentist, when he or she comes in, is making sure that all the X-rays look good. In this image, I have in the red circle is this gray. It's hard to see, but it's this gray, darker spot on the tooth, and that is an indication of a cavity. And this is why dentists have to go to dental school in order to interpret these X-rays that are taken. I work at a dental office, and sometimes I see X-rays, and sometimes it's more clear than others. Dentistry is very subjective, so um, it's good to sometimes get second opinions on these things, but most of the time, X-rays are there to help the dentist provide a good treatment plan for the patient. Also, a tactile examination with the probe. The dentist will go inside of the mouth, making sure that all the surfaces are nice and healthy. And then some treatments. So the obvious treatment are fillings, and those are today in today's society mainly done with composite. Back in the day, they used to use amalgam, but due to the mercury and other risk factors, we have strayed away from amalgam, and we are now using strictly composite. And there's root canals for severe decay, and then crowns or extractions in extreme cases. And in the image on the upper right, you see kind of the difference in those types of treatments, what a filling would be compared to what a crown and what a root canal treatment would look like. And something very interesting that I've seen at a pediatric office recently was this new treatment. It's a silver diamine fluoride. So if, let's say, in the image, there's a cavity in between the front two teeth, what this treatment is that they apply a material, a layer of the material over where the decay is forming. And I think it depends, but I think it's about three appliances. And after the first one, it will start to turn this blackish color. And obviously, this isn't aesthetically pleasing, but as a parent, it's important to know um, that the decay is being taken care of. So, and these are also mainly done on pediatric patients. So, knowing that these teeth will eventually fall out. And this option is very viable for kids that aren't good sitting in chairs and their parents don't want them to be sedated for all the treatment done. So, depending on the type of treatment that the patient will need, this can be a good option for the patient and for the parent. Sometimes it's hard to put your child to sleep, and this route will allow for a harmless and a healthy solution. And then there's also enamel regeneration, which is quite interesting, but it will help reinforce the enamel. Moving on to microbial resistance. So, overuse of antimicrobial agents like chlorhexidine has led to reduced efficacy against Streptococcus mutans. This highlights the need for targeted approaches to minimize disruption of the beneficial oral microbiome. And some karyogenic bacteria are showing resistance to the conventional antibiotics used for secondary infections like amoxicillin. Resistance mechanisms include biofilm formation, which shields bacteria from treatment. And for prevention and public health, you have fluoride, which is used in toothpaste and water. You have regular dental checkups. Like I said, it depends on the person, it depends on insurance. There's multiple factors, but going to the dentist is very important to making sure that you have a nice and clean oral hygiene, which plays into multiple other health benefits. And then also a huge important one that you can do every day would be reducing your dietary sugar intake. I know for kids, we would like to suggest that they stray away from juice, maybe diluting it with some water often is a good solution in order to try to combat that sugary diet. And some emerging research. There's always research being done in the dental field. Mainly at the times it's done just analyzing the oral microbiome, which um, so in one study they're taking a look at the human microbiome. And it's in this project, they're going in a depth analysis of the oral microbiome in the dental health and disease realm, which offers potential to develop therapies targeting the acid part of the bacteria and their virulence factors using metagenomics and metabolic pathway analysis. There's also a nano drug delivery system. These nanoparticles target decay, causing bacteria with precision and reducing side effects. Um, Also, there are, for example, the silver nanoparticle, which is which has antimicrobial properties that will help combat the bacteria inside of the mouth. And for the last one, just a quick summary. So dental caries is fundamentally a disease driven by microbial activity, primarily Streptococcus mutans and associated bacteria, which produce acids that erode tooth structures. Regular oral hygiene practices, fluoride application, dietary modifications are crucial in preventing caries progression, minimizing the need for invasive treatments. And innovative solutions, like I talked about, the silver treatment and the regeneration of the enamel and also nanotechnology are paving the way for more effective and less invasive treatment options with potential to reduce microbial resistance concerns. These are the citations, and thank you for listening.